Communication forms the foundation of the patient-nurse relationship. Imagine a patient anxious and overwhelmed by a new diagnosis. A nurse's empathetic communication can make a world of difference. It's about truly hearing the patient's concerns and providing support beyond medical treatment. Nonverbal cues like facial expressions and body language can enhance or undermine our message. Our facial expressions can reveal a wide range of emotions, such as happiness, sadness, anger, fear, or surprise. Body language encompasses our posture, gestures, and overall body movements. Crossed arms might indicate defensiveness, while an open posture can signal receptiveness. The amount of eye contact we make can communicate interest, engagement, or even intimidation. Physical touch can convey a range of emotions, from affection and comfort to dominance or aggression. Consider cultural norms before using touch. Clothing, hairstyle, and overall presentation can send nonverbal messages about one's personality, professionalism, or social status. The physical distance we maintain during interactions communicates our level of comfort and the nature of the relationship. Vocal cues include factors like volume, tone, pitch, and pacing of speech. A monotone voice can signal boredom, while an enthusiastic tone can convey excitement. Consider a nurse entering a patient's room with a warm smile and open posture. This conveys approachability and empathy. Conversely, a hurried demeanor and minimal eye contact can erode trust. A gentle touch can express empathy and provide reassurance, but always seek consent. Verbal communication forms the cornerstone of therapeutic communication in nursing. It's about using language thoughtfully to foster trust and empower patients. Active listening involves truly hearing and understanding the patient's perspective. Example: I hear you saying that you're feeling anxious about your upcoming surgery. Can you tell me more about what's making you anxious? This statement combines active listening with an open-ended question. This creates a safe space for patients to share their concerns openly. Open-ended questions encourage patients to elaborate and share their thoughts. For instance, instead of asking, "Are you feeling pain?" ask, "Can you tell me more about the pain you're experiencing?" Use clear, concise language and avoid medical jargon to ensure patients are fully informed. This empowers patients to participate in their care. Reflecting or mirroring is restating the patient's feelings or thoughts to ensure understanding and encourage further exploration. Example: It sounds like you're feeling frustrated with the limitations your pain is placing on you. Clarifying is seeking to understand the patient's message more fully by asking for further explanation or clarification. Example: I'm not sure I understand. Can you explain that again? Or, can you give me an example of what you mean? Summarizing is briefly reviewing the key points discussed to ensure understanding and provide closure. Example: So you're concerned about your pain, you're experiencing difficulty sleeping, and you're feeling isolated from your friends and family. Offering self is making oneself available to the patient in a supportive and non-judgmental way. Example: I'm here for you if you need to talk, or I'm available to answer any questions you may have. Effective communication in nursing requires both medical knowledge and interpersonal skills. Empathy involves understanding and sharing the patient's feelings. It means putting oneself in the patient's shoes and seeing the world from their perspective. For instance, a nurse might say, "I can only imagine how difficult this must be for you. I'm here to support you." Such statements can provide immense comfort and reassurance to patients. Validation acknowledges the legitimacy of the patient's feelings. It shows that the nurse respects and understands what the patient is going through. For example, it's understandable that you're feeling frustrated. Waiting for test results can be stressful. This kind of validation can help patients feel heard and understood. Silence can be a powerful tool, providing patients with space to process information. It allows them to gather their thoughts and express themselves more clearly. It demonstrates respect for their need to process at their own pace. This respect can significantly enhance the therapeutic relationship. Providing information is sharing relevant and accurate information about the patient's condition, treatment plan, or other relevant topics. Example: This medication is used to help manage your pain. It typically starts working within 30 minutes. Recognizing and avoiding non-therapeutic communication. Certain communication patterns can hinder therapeutic efforts, leading to misunderstandings and strained relationships. Offering false reassurance like everything will be all right can trivialize the patient's feelings. It minimizes the patient's concerns and can feel dismissive. It prevents genuine exploration of the patient's anxieties. Instead, acknowledge concerns and provide honest information. Changing the subject. Example: well, the weather is supposed to be nice tomorrow. Shifting the subject while patient is verbalizing something avoids the patient's concerns and can make them feel like their feelings are not important. Giving advice can shift focus away from the patient's needs. Example: you should really try relaxation techniques like yoga. Why it's non-therapeutic. It can make the patient feel judged or that their own coping mechanisms are inadequate. It can also prevent the patient from exploring their own solutions. Empower patients by providing accurate information and supporting their autonomy instead. Avoid changing the subject abruptly. Allow patients to express themselves fully. Asking why questions such as, "Why do you feel that way?" can come across as accusatory and may make the patient feel defensive. Approving or disapproving. Example: that's a terrible idea. Or, I'm so proud of you for quitting smoking. These statements imply the nurse has the right to judge the patient's thoughts, feelings, or behaviors. Arguing or challenging statements such as, "That's not true," or "You're just making that up," invalidate the patient's experience and can damage trust. Using medical jargon like, "Your leukocyte count is elevated," can confuse and overwhelm the patient. These techniques can unintentionally hinder effective communication and should be avoided in most clinical settings. The goal of therapeutic communication is to create a safe and supportive environment where the patient feels heard, understood, and respected. Listening with intent. This is the art of active listening in nursing. Active listening is a cornerstone of therapeutic communication, requiring deep understanding and empathy. It is not just about hearing the words spoken by the patient, but also about understanding the emotions and intentions behind those words. It involves fully engaging with patients, not just hearing their words, but also deciphering unspoken messages. This means paying attention to their body language, facial expressions, and tone of voice. Pay undivided attention, putting aside distractions and focusing on the patient's words and body language. This helps in building trust and rapport with the patient. Create a space where the patient feels heard and understood. This can be achieved by maintaining eye contact, nodding, and using verbal affirmations. Seek clarification to fully grasp the patient's message. Ask questions that encourage the patient to elaborate on their thoughts and feelings. Use open-ended questions and nonverbal cues to demonstrate engagement. This shows the patient that you are genuinely interested in what they have to say. Reflect on the speaker's emotions, acknowledging and validating their feelings. This can help the patient feel more comfortable and willing to share. For example, "It's completely understandable that you're feeling scared. This is a lot to process." Such statements can provide comfort and reassurance to the patient. Support patients by answering questions and being present. Your presence and attentiveness can make a significant difference in their experience and recovery. Motivational interviewing empowers patients to become active participants in their health journey. It is a patient-centered approach that encourages individuals to take ownership of their health decisions. It centers around collaboration, recognizing patients as experts in their own lives. This method respects the patient's autonomy and promotes a partnership between the nurse and the patient. The nurse's role is to guide and support patients in exploring their motivations and goals. By understanding what drives the patient, the nurse can help them set realistic and achievable health goals. Use open-ended questions and reflective listening to elicit the patient's reasons for change. This technique helps in uncovering the patient's own motivations and barriers to change. For example, what are some of your concerns about your current health habits? Such questions encourage patients to think deeply about their behaviors and the impact on their health. Acknowledge and explore the patient's resistance to change. It's important to validate their feelings and understand their perspective. For instance, I understand that you're hesitant to make changes to your diet. What are some of the things that are making it difficult for you? This approach helps in building trust and rapport, making the patient feel heard and supported. Therapeutic communication is a strategic approach that empowers nurses to establish rapport and foster trust. These techniques enable nurses to connect with patients, facilitate healing, and promote well-being.